This is inside the JFK Hospital Ebola Treatment Unit, ETU for short, through the eyes of an Ebola fighter.
We started with nothing. The PPE were not happening. We only used to wear our long sleeve, our sock, and our uniform. Usually was what we used to do. So it was not easy for us here.
The other healthcare workers at the same hospital staged a go-slow again for the lack of protective equipment, as they were the first point of contact.
I'm saying that before we can return to work, we need our month of August salary, we need our proper equipment to use to work with, and we need insurance benefit, we need extra per diem to motivate us, because our life at risk. We are at the front page. Coming here today is not anything because we choose the profession, as I said. But equally so, if anything happens to us tomorrow, let us be at the stage that our family tomorrow is going to not cry alone or cry free.
Collecting the blood samples from the patients posed risks to the healthcare workers getting infected. They fought to save lives with their bare hands in many places. There was no protective equipment to ensure that they are not infected. The healthcare workers continue to be underpaid and most lack adequate labor insurance. Some kept away for their personal safety.
The rate at which it's spreading is overwhelming the existing system to contain Ebola. Because the moment health workers started dying, the rest of the health workers kept away from the hospitals. And yet when you fall sick, you should go to hospital and get a health worker to treat you. So when the hospital shut down, where would the patients go?
The number of patients per bed was outnumbered, thus creating stress for the doctors and nurses working in the ETU.
Well, there are very few Ebola treatment units. As we speak now, we only have, I think, 4. Very limited space. JFK takes 35 beds. That's the bed capacity, but they go up to 70 patients, and then that's the limit. They have nowhere to put the patients.
Following several cries, the international community came in with help, but the worst has been done. There are no ways to undo the deaths of fallen physicians in the fight. Those that got infected narrated gruesome ordeals experiencing the deadly virus.
Well, my situation first, when I contacted the virus, I was very, very bad. Very, very bad. But I thank God first. God comes first in everything.
So when you are in that center as a patient, all you feel is, you could die anytime.
Different curative methods were utilized by the healthcare professionals in the fray. A specialized medical unit was built. This reduced the number of healthcare workers dying, but it did not stop the marginalization and abuse of their rights.
Our global partner, Public Service International, organized a delegation to attend a UN Ebola Recovery Conference. We took that opportunity to organize a conference called Honoring the Fallen to welcome those who cared for their patients during the epidemic. It was also an educational opportunity for U.S. healthcare workers and employers. Our union immediately partnered with our hospital leaders in New York and in California to provide training for 5,000 frontline healthcare workers on health and safety protocols in caring for Ebola patients. Some of our hospitals became Ebola-designated facilities. It was important for our members to know that 400 healthcare workers in Liberia, Sierra Leone, and Guinea died of Ebola while taking care of their patients and communities. We remain committed to ensuring that our sisters and brothers in West Africa have access to the same kind of resources and training to take care of their patients and to ensure their own safety while doing it.